Hello, everybody, and welcome to our August webinar. Thank you for your patience as we were able to reschedule it. Sorry about Friday. The original date had to be moved because of a technical glitch. So we are going to let people get logged in and get settled, and then we are going to get started. I definitely want to respect everyone's time, so we are going to jump in and talk about complex kids and mycotoxins. So if you have any questions, please drop them in the Q&A box and I will answer them as I'm able or as it's appropriate. I'll definitely answer all questions before we sign off. So, all right, so let's get started. So I am Dr. Sonia McGowan. I am the owner of Covenant Pediatric Wellness Center and Covenant Pediatrics in Jefferson City, Missouri. I have, my education is as a chiropractor, but I have worked with kids with complex needs, mostly kids with autism, for a really long time. So starting in college, I worked with adults with a variety of complex needs like autism, deafness, blindness, worked with a lot of people who were both deaf and blind, lots of behavior challenges. So as my second career, I became a chiropractor because I really wanted to use a holistic approach in intervening with kids with autism and other complex needs. So again, the practice is in Jefferson City, Missouri, and I live here with my husband, Shannon, who you see there on your left. He is a CPA. He's actually getting ready to retire pretty soon, so we're excited about that. We have a newly empty nest, but we have our daughter, Libby, who lives in Kansas City. She's a music director for School of Rock, and so she's actually turning 21 next week. She's a big girl doing her own thing, and we're super proud of that. And then we have Rowan. He is 19, getting ready to go back for his second year of school at Millikan University in Illinois. He is a theater costume design major, so he's quite talented. And he really is the reason that I started this practice and why I have designed it to be the way it is, because when he was a little guy, he had a lot of challenges, and that's him in that picture holding his ears. If you're a parent of a kid with complex needs, I'm sure you've seen that posture before, trying to get a haircut, and it just was a no-go. And so he's come a really long way. He's completely neurotypical now, but kind of had a rough start. And so I felt it was very difficult to get the right help for him. And so I didn't want any other family to feel the way that I felt about that. And then the top corner, that's Ozzy. He's our sheepadoodle. He's about 10 months old now. This was him when he graduated from puppy school. So yeah, he's a much bigger boy these days. So all right, so let's talk about Covenant. So we do lots of things here. We have lots of ways to help people. One of our primary focuses is kids with complex needs. And so we work with kids with autism, ADD, ADHD. We work with, kids who are constipated, who don't sleep, really any kind of challenge that a baby or a child may have, we can help. So we do neurologically focused chiropractic, we do neurodevelopmental exams, and then I also do functional nutrition. So we use a lot of labs to really get to the root cause of why the child is behaving the way they are, why they have the symptoms that they do. We also have craniosacral therapy. And so super busy practice, but we're always taking new patients. I can't imagine there ever being a time when we stop taking new patients because the need is so great. We also have Covenant Pediatrics. So Dr. Hannah Strong is our board certified pediatrician. She's developing lots of experience in complex kids, as well as just standard pediatric visits as well. She is also taking new patients. We have the Spot for Tots, which is an arm of the practice that provides a comprehensive evaluation and intervention for oral restrictions. So we do, again, the evaluation. We do craniosacral therapy, myofunctional feeding therapy, et cetera, to then be able to prepare a child for that tongue or lip tie release. And then our early beginnings program is really focused on prenatal and pediatric chiropractic. We also offer craniosacral therapy for babies, lactation consultation, feeding therapy, etc. So we do lots of important work here. And so if you're interested in becoming a patient, I'll share the contact information at the end. So let's talk about mycotoxins. So mycotoxins are toxic compounds that are produced by certain types of mold. They're found on a variety of foods. They're also found in the environment, and they have pretty significant health effects. So these are compounds that are harmful when we ingest them on food, if we inhale them, or if they become absorbed through our skin. So I'm going to talk to you about some of the bigger mycotoxins. We're going to talk about where they come from. So what sort of fungus they are, how they're found, food sources. So the F in the slide stands for food sources. We're going to talk about environmental sources. So that's the E, and then H is health effects. So we're going to go through each one of these. And I'm going to sort of help you understand why it's a big deal for complex kids and how it seems like mycotoxins they just have such an affinity for complex kids. Kids are very vulnerable to this. And so it's often overlooked by most doctors, but it's a really big deal. And you need to know about it as a parent or even as a practitioner. So the first one we're going to talk about is called aflatoxins. Aflatoxins are produced by Aspergillus, and they are generally found on contaminated grains like corn, wheat, or rice. We also see them on a lot of nuts and seeds as well. Environmentally, primarily we see this particular mycotoxin in water damaged buildings. So think about, if your basement flooded, you had a leak in your roof, you've got, maybe the sewer backed up in your house, or your hot water heater went kaput and leaked water everywhere. If damage from water is not appropriately remediated, mold can grow. And then before you know it, it's out of control. So water damaged building doesn't necessarily have to mean, like it was in a flood or something. It can mean a leak in your sink that you don't know about, or your shower. So when we talk about the health effects of aflatoxins, generally, what we're seeing is that they are cancer causing if the load is great enough. Generally, we see liver damage. We see an effect on the immune system. So generally, mycotoxins really burden the immune system and cause a suppression of an appropriate immune response. We will also see that mycotoxins reduce the level of glutathione in the system. So glutathione is your master antioxidant. It's very important for your detox pathways. The other thing that it will cause is mitochondrial dysfunction. So if you've listened to me talk at all, I talk all the time about mitochondrial dysfunction. So within our chemistry, the whole point of eating is to turn that food into energy, to make your body go, right? To fuel your brain and your nervous system and all of that. And so when we talk about complex kids in particular, aflatoxins knock out their glutathione, which they already tend to have trouble with glutathione deficiencies to begin with. And it really knocks down the mitochondrial function, which is also a really common theme across kids with complex needs. And aflatoxins are known to cause developmental delays in kids as well. All right, the next one is ochratoxins. So ochratoxins are produced by two different types of mold, Aspergillus and Penicillium. Generally, in terms of food sources, we see this on contaminated cereals, coffee beans, wine, certain fruit, some bottled water. Environmentally, again, with the water damaged buildings and any sort of damp indoor environment, we will end up finding a lot of ochratoxins. And so this particular toxin causes kidney damage. Again, it suppresses the immune system. Again, with the mitochondrial dysfunction, it increases oxidative stress and will often cause neurologic symptoms. If you're not completely clear on oxidative stress, go to my website called thewhymatters.net and go to the blog section and scroll down, and you'll find a blog that explains oxidative stress. All right, this one, good luck saying it, right? Zearalenone. zearalenone. Your guess is as good as mine, right? We call it ZEA. It's produced by a mold called Fusarium, and generally it is on grains as well. So corn, rye, wheat, barley, etc. Primarily found environmentally in the water damaged buildings. And the ZEA is important in the big picture, not just with kids, but because it affects estrogen, it disrupts hormones. And so a lot of times, I'll have adults come to me and they have a lot of hormone dysregulation. And if the things that I generally do to intervene on hormone issues don't work, then I'm immediately wondering about this particular kind of mold. It will also cause digestive symptoms, so lots of weird poops, lots of abdominal pain, gas, bloating, things like that. And then it also really affects immune function as well. And of course, we know kids with complex needs tend to have not a very balanced immune system, and they tend to have a lot of digestive symptoms. So again, you can see why kids who are complex really are at a special disadvantage when it comes to mold toxins. All right, now trichothecenes. These particular toxins are caused by a few different types of mold. We have Fusarium, we have Mycotoxin, we have Trichoderma, but also Stachybotrys, which is black mold. It generally is found again on the grains. So grains are a real theme that we're seeing here. So again, the corn, the rice, wheat, barley. Water damaged buildings, dampened building materials. So let's say, there's a construction project, you're building a house, or they're building a new therapy center, and the building materials sit outside, they get rained on, right? So those, the dampness of that can definitely cause this particular type of mold to proliferate. And again, so we see themes, right? We see that this particular mold really disrupts mitochondrial function, disrupts digestion, disrupts immune function. And then we have citrinin. So citrinin is produced by Aspergillus, also by Penicillium, again with the grains as a major food source, but then also certain spices, certain cheeses, and fruit as well. Water damaged building materials is generally the environmental source. And the citrinin, you'll also hear it called multiple mold species on certain test results. It is cancer causing, so it's a carcinogen, disrupts kidney and liver function, and also destabilizes the immune system. And when you think about complex kids, right, these are really common symptoms that they have. Most complex kids have digestive issues. Most complex kids have mitochondrial dysfunction. They have immune dysfunction. And so it can be really difficult to sort of tease out, what's causing what. So we have to be fairly strategic and intentional about the way we assess the symptoms and really drilling down to find the root cause of that. All right, mycophenolic acid. You'll also see this called MPA. It's produced by Penicillium. It's very prolific in the soil, but then we also see this occurring on certain fruits and certain dairy products. It comes also from the environment in water damaged buildings, and again, suppresses the immune system and really promotes inflammation. And again, inflammation is another common theme that we see in complex kids with autism, pandas, etc., tend to have pretty significant levels of systemic inflammation. And then we have sterigmatocystin. This is produced by Fusarium, Stachybotrys, Penicillium, also found on contaminated grains and other foods too. So cheese, nuts, certain fruits, soy, spices. And then we see that this mycotoxin is present in dust, so it's easily inhaled, and then water damaged buildings and water damaged building materials, things like drywall, insulation, things like that. So like some of the others, also cancer causing, very disruptive to digestion, to kidney and liver function, destabilizes the immune system, and definitely increases oxidative stress. Because remember, most of these are sucking away glutathione. It's your master antioxidant. So it's going to, because we're losing antioxidants, we're increasing that oxidative stress. So again, any questions about oxidative stress or mitochondrial dysfunction, you're going to find either a previous webinar or blog that helps you understand that some more. But definitely, if you have questions, drop those in the box. So those were, sort of the main mycotoxins. There are many more, but we're limited on time. Let's talk now about symptoms of mycotoxin exposure. So we generally have pretty significant neurological symptoms that can include mood issues like depression or anxiety. We see a lot of so people who have the verbal skills to describe how they're feeling often talk about that they feel cognitively like they're just not the same. They have word finding problems, they have memory problems, they just are foggy, their brain, they have a lot of brain fog. So lots of cognitive sorts of impairments. We also see things like dizziness and headaches. We also see symptoms that look like dysautonomia. So if you have questions about what dysautonomia is, again, you'll find a webinar and a blog about, actually two blogs, I think, about dysautonomia. So have a look at that and see if it seems to fit yourself or your child or whoever you're interested in helping. As you can imagine, we see respiratory issues, right? Because a lot of this is inhaled. And so we'll see kids with a lot of sinus infections. We'll see chronic coughs, asthma, and to the point of the sinus infections. So we tend to see lots of kids here who have a lot of sinus complaints. So a lot of sinus infections, a lot of congestion, just that stuffiness, a lot of runny noses. And so I very frequently do a nasal swab that cultures out the microbiome of the sinuses. And it will culture bacteria and mold toxins. And so, not mold toxins, just mold, fungus in general. And so it never fails to surprise me, all of the ugly bacteria and fungus that we find in kids' sinuses. And that is a really important thing to figure out and know, because that creates just a huge list of symptoms. But also, when we don't know that that's what's happening in the sinuses, it's a real roadblock for kids to progress and to get better. We see a lot of gastrointestinal symptoms. So belly pain, nausea, vomiting, poop problems. But again, right, we've got to tease that out. So many kids who come to us have this list of symptoms. They have nausea, they vomit, they have belly pain, they have weird poops. And so, we have to just be systematic about how we assess what is causing what. Immune system symptoms, we've talked a lot about that mycotoxins are really burdensome to the immune system. And so we'll see a lot of frequent illnesses, we'll see a lot of chronic infections, and sometimes we see skin symptoms too. So rashes, hives, things that, people are just told it's eczema, right? But it's not eczema. It's like, what is it? It's rashes that don't seem to really fit the diagnostic scope. All right. We also see pretty significant developmental and behavioral issues in kids. So we'll see things like hyperactivity, impulsivity, lack of focus. Sometimes we'll even see things like aggression. We see lots of emotional dysregulation and compulsiveness. So remember, again, I'm all the time talking about PANS and PANDAS. If you've not heard me talk about it, go back. There are multiple webinars, there are multiple blog posts about it. But mycotoxins are a PANS trigger. So we have PANS and PANDAS. PANDAS is caused by strep. PANS can be caused by a multitude of other things. Mold is one of them. Other bacteria, certain viruses, PANS can be tick-borne. PANS can be metabolic in terms of maybe anesthesia or environmental toxins. And so if we're seeing a sudden onset of things like compulsiveness, obsessive thoughts, change in urine habits, vocal or motor tics, severe emotional dysregulation, we immediately need to be thinking about PANS or PANDAS, and we need to dial in on what is the trigger. And sometimes mycotoxins are the trigger for that. All right, so like I have sort of alluded to throughout this webinar, complex kids are vulnerable, particularly to mycotoxins, for a lot of reasons. So what I have been saying for years and years is that kids with autism and other complex needs have a similar list of symptoms. So most every kid who comes through my door who has some sort of complex issue has a similar list of symptoms. I expect to find these things. I expect that I'm going to find mitochondrial dysfunction in most kids. I also commonly see nutrient deficiencies. I see immune dysfunction. I see that they have very impaired detoxification pathways, and they just tend to be sponges for environmental toxins. That might be mold. It might be environmental chemicals, cleaning products, plastics, things like that. Kids just, because their constitution is not as robust as we would like it to be, they tend to really soak in the toxins that other people in their family may not. And so because they're vulnerable due to these issues, mycotoxins can be a really big deal for them. A tricky thing is that sometimes in families, they live in the same home, child with complex needs, we do the testing, we find huge levels of mycotoxins in their system. We test mom or brother or dad or sister, and not so much, right? We don't find those same extreme findings in them. So it really kind of depends on the child, their level of health, their constitution, as to how vulnerable they are. So it's entirely possible for members of the same family to have different findings when it comes to mold testing. All right, so how do we test for this? Generally, I use a test called the Mycotox profile. It is a urine test, which is nice. It's a first morning urine. So for most kids, urine is easier than other things. And so it basically gives us a look at exactly where the child stands with each of the molds that we talked about, plus some additional ones as well. So this particular child, you can see, this is just the summary. The actual report is many, many pages long. And so it covers each of the different mycotoxin classes. And then it gives a lot of background information in the detail of the test. But on this particular summary page, what you'll see is each of the different types of mold that the child was tested positive for. And then you can see their actual results. So you can see where they fall on the continuum of severity. So you can see that ochratoxin A is a big one. Citrinin, the mycophenolic acid is through the roof. So is the STC as well. So while these numbers are very different, you're really looking and comparing it to the normal range. So normal for the STC is 0.4, and this child was over 3. The MPA normal should be less than 37. His was almost 300. So this test is affordable. It's just over $300. Again, it's a urine test, but it really helps me, number one, know if mold is part of this picture. It lets me know exactly which ones are at play so that I can design the best intervention plan for this particular patient. So let's say we find mycotoxins in a child. What are the interventions? So I really start by assessing and intervening on their vulnerabilities. So if they have nutrient deficiencies, we work on that first. If they have mitochondrial dysfunction, that's number one as well. We also then, whatever else we might be finding, whether it's detox pathway impairment, whether it's intestinal health challenges, those are things that I stabilize first. If we don't, if we jump straight to dealing with mycotoxins and the child isn't pooping, they don't have good detox pathways, they can't make energy inside the cell, they're never gonna respond well to mycotoxin intervention. I generally kind of come at this with a 4-pronged approach. And again, I don't use blanket interventions on every, same thing on everybody. It's not what I do. I base it on the child's symptoms, their history, and their test results. And so generally what I will do is homeopathy specific to mycotoxins, nutrition support. I also use a binder because, we unearth those mold toxins. We've got to be able to bind those and get them out of the system. And then I really also like to include an active detox. Specifically, I use the Ion Cleanse by AMD, the foot bath system that we have here in our office. When we do the homeopathic and the nutrition, the binder, plus the Ion Cleanse in a very strategic way, we are very successful at moving those mycotoxins from the system. And so generally, I start with a baseline test, and then after a certain period of interventions, then we will repeat that urine test and compare apples to apples and just make sure that we're moving in the right direction, making sure doses are appropriate. If we, need to add something, take something away, we base it on those test results. All right, so that was a quick and dirty look at complex kids and mycotoxins. If anybody has any questions, drop them in the Q&A box, and I will answer those really quickly. In the meantime, just to give people a second to write out any questions, our next webinar is on September 13th at 9 a.m. The topic for that is, what are the best lab tests for complex kids? So we'll be talking about why it's important to actually do labs and specialized testing on kids with autism and other complex needs. We're going to talk about the specific tests that I tend to use, what those tests tell us, and then how those results guide interventions. So that happens again on Friday, September 13th. And then for October, we're going to be talking again about PANS and PANDAS. So that'll be October 4th. We'll be talking about the symptoms, the diagnostic criteria, the triggers, the testing that we do, and then the interventions as well. And then for November, we'll be talking about food allergies and sensitivities, kind of talking about the difference between those allergies and sensitivities, how food allergies and sensitivities can affect behavior and their health, the testing that we do, and then what we do about that. So that is sort of our upcoming lineup. And then the final one is December 13th. We'll be talking about mitochondrial function and why it's so important for complex kids. So generally it's the first Friday of the month. Sometimes with holidays and things like that, we have to change things around. So in December, it'll be the 13th, two Friday the 13th in a row. All right. So any final questions before I let you go? Please drop them. This is our contact information. So our address is here. We also offer telehealth appointments in some cases. If you want to reach me, this is my email address, our phone number, our web address as well. So if you ever have any questions, you can also, if you're particularly interested in scheduling with me for a complex kid appointment, the very best way to start that process is with getting in touch with Brittany. So she manages all of my scheduling. And her email address is brittany@covenantwellness.net. And she will definitely reach back out to you and get you started. So thank you so much for coming. I hope you found it helpful. If you have any questions at all, you can email anytime. We're happy to answer all of parent questions. So everybody have a great rest of your week, and we'll see you next month in September. Thanks.